How I introduce myself to patients is, hi, my name is Nyberg. I'm a physiotherapist. But my official title is Dr. Nyberg, University Physiotherapy Lecturer. I quite like my job. There isn't really an average day. I have to put on so many different hats. So sometimes I'm in teaching, sometimes I'm doing a bit of paperwork, unfortunately, in the background. Sometimes I'm in clinic, but you never know what's kind of coming at you. It's busy, but good busy. The other skills you have, I think, is compassion and resilience, because often in these situations, be it a student or a patient, you're not the most vulnerable person in the room, they are. So having that resilience to kind of adapt to the situation, despite how you might be feeling exhausted, worn out, a little bit more to press on and make sure it's a priority. So having that willingness to learn is, I think, absolutely critical. And that's not just from the thigh joint connects to the hip joint or wherever it is, but it's also realizing that there's a person behind that as well, and that they have needs and barriers that you have to overcome and work with them in order for them to progress. There's so many different specialties, and there's so many different angles you can take this from, but someone that is flexible, I think, very, very flexible would suit them the most. Because you just need that to adapt to the ever-changing atmosphere. You need to adapt to your patients, you need to adapt to the students. So in clinic, I think the most difficult part is it can take a bit of an emotional burden. People's lives are very, very difficult, and a lot of times that's the biggest impact they have on their health. And they have that trust in you to help them get better. In regards to teaching, it's really getting the message out for everyone. It's so difficult when you have that step up, when you kind of in higher learning, when you kind of take that different approach. It's how do you teach that? What angle do you kind of go to kind of present that information? Make sure that students have that ability to kind of look at things from different angles. I keep all the cards patients give me, keep all the cards students give me. They sit on my desk. When I'm feeling down, I have a look at it, so it keeps me going. Telling me someone, thanks, you helped me walk again. That's really powerful. And when it comes to teaching, it's seeing that growth. When you're planting that seed and you see kind of what they were before and how they are now, you see that kind of change in their thought and their ability to rationalize and the ability to, from knowing nothing to knowing so much. It's amazing. So I did my high school years secondary school years over in Sweden, and I wanted a bit of a change from my small sleepy town, so I went over to Scotland to do my training. And I really like biology, I really like sport, so try to combine those two passions together. So I originally did my degree in physiology and sports science. I said yes to everything and was constantly looking for opportunities. You make those connections, take advantage of that. After I did that degree, I did a doctorate in physiotherapy and worked for the NHS for a bit. And then after that, decided, I want to give back. So went to lecturing. I did take time out for mental health reasons. So it never is, but that's okay. That's what I needed. So it wasn't going from A to B to C. I took a full year out and did something else. I worked in an orphanage instead. But that's what I needed. But came with a plan, be like, I'm not well. So I came with a plan. I was like, right, what can I do to get better? I think actively just worked at it during my time. And then slowly saw those improvements. I saw that change in my behavior. I started feeling happy again. But that's what I needed. I needed to be in that space to take on those extra challenges. And it's not easy. It is hard, but it happens and it's normal. Lots of people go through it. It's only about 1% of physios that work in sport. I think most people start out with that goal and then realize it's not for them. I certainly was the same as well. So I suggest reach out to someone, be it online or your local clinic, to really discuss what is the profession, because there's other elements. There is the respiratory part, and those guys actually save lives. You can work in cancer wards, you can work in elderly wards, you can work in people's homes, work with people after heart attacks, after strokes, people that have neurological conditions. So the list is endless. And sport, yes, you think you'd be going for the glory. I've done there. I've worked with people that were on TOWIE. I worked with Olympians. I worked with stuntmen. I worked with the Paralympians. The glory is all right for 3 months, but in the end, people are people. Clinically, you're looking at that just south of 30,000. I believe it's around 27. That tends to be industry standard at the moment. And then as you progress from band 5 to 6 to 7 to 8, you're looking roughly about your mid 40,000s. As a lecturer, you start at your about 40,000 and then you work up. If you go all the way to vice chancellor, you can earn quite a bit in academia, but you're likely probably going to cap out around your 80, 100,000. Talk to someone, get to know really what it's about. I mean, you're putting a lot on the line for the rest of your life. And so with that, seek opportunities. Ask around, kind of shadow you, kind of look at you, just to get that experience and truly know what you're getting yourself into, because that's what we want to know. It's a little bit different than you might expect. And with that, continue that hungerness, continue that curiosity. A lot of doors opened up to me just because I said yes, or went looking for them. And I meant for every yes I got, or for every request I got, I probably got 50 no's. It's just continue to look for those opportunities, because they're oftentimes not going to be handed to you.